I never realized the importance of knowing about syphilis until I went to my first STD clinic. It was a scary experience, but I left feeling educated about the disease and how to prevent it. Let's learn about syphilis in this short video. A sexually transmitted illness or infection is syphilis. Men are more likely than women to have it. Your genitals, which are both internal and external reproductive organs, are typically affected by the infection. It may also have an impact on your anal region and the rectum, the final segment of your large intestine. Your tongue, lips, or other body parts could also be impacted. Treponema pallidum, a type of small spiral or coiled bacteria, is the infectious agent. Sexual contact with a person who has syphilis at the time, particularly one who has sores or lesions in or around their mouth or genitalia, puts you at a risk for contracting the germs. Additionally, syphilis can be transmitted during pregnancy by pregnant women who have the illness. The tissue that lines many of your body cavities, such as the tissue lining in your mouth, genitals, or anus, is another entry point for the bacteria into your body. The bacterium can infiltrate your body and spread throughout it in a matter of hours. The primary stage, the secondary stage, the latent stage, and the tertiary stage are the subsequent 4 illnesses. Stages with varied symptoms that might manifest over a period of 10 or more years. Within a few days or weeks, you may develop 1 or more chancres, which are extremely contagious but frequently painless sores. These sores could last for a few weeks. The condition will advance to the secondary stage if untreated. Along with lesions, a rash could develop on any or all of your body during this phase. Fever, headaches, sore throat, swollen lymph nodes, patches of hair loss, weight loss, muscle aches, and weariness are some additional symptoms that may appear during this period. Syphilis is sometimes referred to as the great imitator because of other illnesses also present with identical signs and symptoms. About 1 to 2 years after the infection first manifested itself, the latent or hidden stage typically starts. At this point, the rash and sores have disappeared along with the other symptoms. However, the germs will remain in your body if you don't get therapy. Years may pass during this phase and you may still be able to infect others. Even though the 3rd stage of syphilis is uncommon, it can develop 10 to 30 years after the initial infection. The bacteria may travel to your liver, bone, joints, eyes, heart, blood vessels, brain, and many other bodily organs during this phase. Depending on how far it has gone, the symptoms will vary. It is extremely dangerous to have tertiary syphilis since it can harm your internal organs and be fatal. The biggest risk factor for contracting syphilis is coming into contact with a sore when engaging in vaginal, anal, or oral intercourse with an infected person. If you engage in sexual activity, or a man who engages in male-to-male contact, have the immunodeficiency virus HIV, use medication to prevent HIV, or have 1 or more syphilis-positive partners, you may be at increased risk. Untreated syphilis can spread to other parts of your body at any point. For instance, when syphilis spreads to your brain and nerves, it causes neurosyphilis. Neurosyphilis symptoms might include headaches, weakened muscles, and trouble moving, as well as mental issues including confusion or difficulty focusing, remembering, thinking, or making judgments. When syphilis spreads to your eyes, you have ocular syphilis. Ocular syphilis symptoms might include eye pain or redness, alterations in vision, or even blindness. Otosyphilis is the name of syphilis that affects the ears. Otosyphilis symptoms might include hearing loss, vertigo, the sensation that you and everything around you is moving or spinning, dizziness, and tinnitus, a ringing or buzzing sound in your ears. Speak with your healthcare provider if you believe you could be experiencing syphilis symptoms or if you simply want to learn more. Thank you for watching my video. Subscribe to get regular updates on my channel.